Welcome back to the morning show. Now, we will be going into conversation with Dr. Ifeyinwa Anih-Osheku, who is Executive Secretary of Enugu State Primary Healthcare Development Agency. Good morning and welcome to the program.
Good morning, and thank you for having me. Thank you.
All right, great. I'm glad you can hear us loud and clear. Well, let's get straight into it. As, of course, Enugu State was recently in the news for cutting back on infant maternal mortality by a massive 400%. What a great achievement. But before we get to that, what was the state of the primary health care in Enugu when the Governor Mba administration came in? Did you do any baseline studies to establish the challenges, if any?
Yeah, thank you. Good morning, Arise TV, and good morning, Ndi Enugu. Yes, so at the turn of the administration of Dr. Barrister Peter Ndobese Mba in 2023, we had an extensive baseline assessment, essentially to understand what was going on around the primary health care. That was a very extensive study, and at the end, I'll just go straight to, what we were able to glean from that study. At the end, we found that the Enugu State had a total of 557 primary health care centers across the 17 local government areas in Enugu State. And this study was essentially to throw more light on the state of the infrastructure, the available equipment in the hospital, as well as the available human resource across the primary healthcare space. That study further breaking down the state of the infrastructure in the primary healthcare, we noticed that about 50% of the available primary health care facilities at the time were either housed in dilapidated structures or they were housed in shanties, and they were not suitable to provide equitable services to the people of Enugu State. Furthermore, we noticed that about 35% of what we found out, this is away from those that eventually would need brand new construction. We found out that about 35% of those would go on to need major renovation, leaving about 15% of those facilities that met up to the national standard. So putting together the statistics, 457 out of the 557 available primary healthcare centers that we had would either require fresh construction or would need major renovation. And this cuts across the state of the infrastructure. Most of them didn't have the available medical equipment to be able to provide these essential services that we speak about. It's not just about the essential services, but being able to ensure that you have availability of the essence of the primary health care, which are in two prongs: the human resource as well as the available commodities. In terms of the human resource, we found out that Enugu State, to be able to drive that health sector, we know that the fulcrum of any health sector is its ability to achieve universal health coverage. And the pathway to achieving universal health coverage is primary health. So we noticed that at the time, based on the available human resources in Enugu State, we had barely 40% of what was needed to drive that sector. In actual figures, we had about 2,973 primary healthcare workers, and what Enugu State would need would have been about 7,500. So I'll just go on to speak about what we found at the time that we took over. Coming back to the state of the infrastructure, all of these facilities that we spoke about either didn't have available staff quarters, or they didn't have basic wash amenities, or they didn't have perimeter fencing. So this was the state of our primary healthcare sector at the time that we took over. However, a lot has happened between that time and now. I did say that out of the 557 primary healthcare facilities, up to 85% of them, representing 457, would either require fresh renovation, fresh construction, or renovation. And this is what has given birth to the novel construction of the type 2 primary healthcare centers in Enugu State. In Enugu State, currently ongoing at this time, is a construction of 260 type 2 primary healthcare facilities. Enugu State has 260 political wards. So every ward is going to get every ward is going to get one primary healthcare facility. And this is as a result of the inclusive nature of the administration of Barrister Dr. Peter Ndubuisi, just to ensure that that sector gets the push that it requires. However, the 260 would definitely not be enough. So in order to be able to assure qualitative, effective, essential health to the people of Enugu State when and where they need it at a cost that the community as well as the individuals can access. Peter Ndubuisi's administration is also embarking on renovation of existing primary healthcare facilities. To be precise, October of 2024, Peter Ndubuisi's administration ensured the re-equipping of 3 of our type 3 primary healthcare facilities. Now, you may be wondering what the difference is between the type 2 and the type 3. The primary healthcare sector has 3 tiers of its primary healthcare facilities. We have the tier 1 or the type 1. So this type 1 essentially are health posts. Their major strength is in the provision of immunization. Type 2 primary healthcare facilities go beyond that to ensure that they are able to treat minor illnesses, provide antenatal services, ensure that basic resuscitation equipment for deliveries are made available. Importantly, the provision of round-the-clock medical personnel to ensure that individuals get the kind of health care that they need. For the type 3 is a more advanced primary healthcare facilities that would definitely provide everything that type 2 provides. In addition, it also has a theater that is able to provide minor surgical intervention. So, Dr. Barrister Peter Ndubuisi's administration, to ensure that Enugu State had the right kind of balance, not just in the provision of the type 2, but also being able to take it a notch higher to ensure that the health of the people are assured. We know that what primary health does is to ensure that it provides health care basically to the doorstep of people in the community. One of the guiding principles is to ensure that an individual in a community would not have to travel for more than 5 kilometers, approximately a 10-minute walk, to be able to access care.
All right.
Now, whatever the type 2 is unable to handle, the type 3 can then, come in and bridge in that gap.
All right, Dr. Anih-Osheku, thanks for this very elaborate explanation. On the one hand, it sounds to me like a harsh assessment of what Dr. Mba's predecessors did. And I know for a fact that the immediate past governor, for example, Ifeyinwa, and then Sullivan, Chime, key area that they also claimed that they focused on, was on primary health care. But here you are telling us that you didn't meet anything significant, but of course, we take that. So my point will be, so what in specific terms have you done, as the state government done, beyond the 260 type 2 and type 3 healthcare facilities that you have mentioned? And then more importantly, will be the question around manpower development for these healthcare facilities. People will be wondering that, will you source them from the state, from Enugu State, or will you have to go outside of the state to ensure that manpower development, that will man all these facilities that you are talking about, are available?
Thank you very much. Development, as it were, in the health sector is a continuum. Primary healthcare has not always existed. It is the brainchild of the then Minister of Health, Professor Olikoye Ransom Kuti. And at the time, it was not as elaborate as what we have presently. So there has been progressive growth. At the time it started, it gained so much popularity and it was able to achieve its purpose. But there was another era where there was a general decline, not just in Enugu State, but across Nigeria. However, because of the central role that the primary healthcare sector holds in primary health, there has been intentional, deliberate efforts across all governments to be able to revive that sector. So that is what has been happening. The past administration has tried to revive that sector, and indeed, they were successful in being able to inject some degree of life into it. So what we are doing is to be able to raise the bar to what it should be, and perhaps be able to go beyond the bar, because what we intend to do in Enugu State is to ensure that our primary healthcare sector becomes the beacon of primary health and perhaps a model for other states to adopt. Now, coming back to what we have done specifically, which has been enabled by Dr. Barrister Peter Ndubisi-Mba, by this time, the whole of Nigeria and the world knows very well what his mantra is. And to be able to achieve that mantra of the tomorrow is here, he's focused on economic development. Now, to be able to achieve economic development, the key lies in healthy population. And this has been proven. His intervention in primary health. Now, we keep harping on primary health, but that is not the only health sector that Dr. Barrister Peter Ndubisi's administration is focused on. His intervention spans across the entire range of the health sector, the secondary, the tertiary, but we are focusing on primary health. Aside the construction, the intentional construction of the 260 Type 2 primary healthcare center, which, by the way, each of these facilities have a 13-room segment that is intentional in being able to provide for maternal, especially we have a well cut out section for our maternal care that takes into account delivery, post-delivery recovery, consultation, pharmacy, lab interventions, and the rest. It also has, in addition, 2 well-equipped staff quarters to ensure that we have constant availability of manpower. We are not just stopping at that. We know that the cost of energy is on the increase. So each of these facilities come fitted with a 10 kVA renewable solar energy. In addition, it also has solar-driven borehole as well. Now, in addition to the infrastructural upgrade, we are focused on ensuring that the very essence of the healthcare sector is injected. When we carried out the analysis, we found out that for Enugu State to be able to get to its target in terms of human resources, given the constant wave of the Japa syndrome, the attritions that happen around the health sector, we would require about 7,500. I already mentioned that what we met on ground was about 40%. Based on the gap of about 60%, if you may, in the first year, His Excellency has approved the recruitment of 2,200 primary health care workers. And this represents approximately about 50% of that 60% that we spoke about. It is very intentional because what we want to do is to be able to inject that much needed life into the primary healthcare sector. And this would be concluded within the first year. Allow me to also make mention that the recruitment is already on the way.
Okay, just as we're talking about, I'm glad that you're focusing on, on the manpower and this mass recruitment of personnel, because you know, if you look at the historical antecedent, just as recent as last year, in fact, there were several doctors' strikes, indefinite strikes, and the issues were around welfare, even around security on the premises where the doctors work. So I just love to understand what capacity has been developed to be able to afford the recruitment of this big number and to ensure that their welfare is prioritized?
So thank you very much. Right. Now, so at the beginning of the conversation of the recruitment, it was a conversation that started even before His Excellency came into power, because he already had statistics, you know, guiding him on most of his intervention. But with accurate data, we were able to make budgetary provisions for the 2,200. So it's not an afterthought. So all of this staff already had their budget already included in the state's budget. So all we need to do is just get them in, and then we're able to pay them. Now, we're not just stopping at that, because we realize that the incentivification of health workers is something that gives them a sense of belonging for as much as they give back to the society. One of the things that His Excellency's administration has ensured is to ensure their safety at their place of work. So each of these facilities come fitted with a perimeter fencing. It also has provision for security. We ensure that our staff, when they are on duty, are also housed in that same compound, so as to ensure their security as well. There are also several incentive measures that are also being put in place for them to ensure that they are as comfortable as they need to be and be able to provide 24/7 care to the people. One of the other issues around why medical personnel will probably not get that feeling of satisfaction is in the inadequacy of the equipment that they need to be able to carry out their practice. That is not the case in Enugu State. In our type 3 primary healthcare facilities, we can, and then I stand to be corrected, we can compete in terms of the equipment in those facilities with any tertiary institution. Our labs are equipped to carry out all forms of investigations, chemistry investigations, hematology investigation, spectrometry.
Fantastic.
We've got ECG, you can name it. So our healthcare personnel definitely are getting fulfillment from being able to practice in a place where they are not limited.
And on that note, Dr. Ifeyinwa Anih-Osheku, thank you so much for your insight. We continue to wish D Enugu all the best, and congratulations again on the rollout of those centers.